What if one of the biggest lessons in healthcare comes from a cancer patient, his wife, and one nurse who simply refused to disappear? In Minneapolis, Minnesota, Richard Lee Streng, known as Rick, was living with liver cancer. His wife, Kay Croft Streng, was trying to navigate an increasingly complicated journey through treatment, hospitalizations, setbacks, and eventually hospice. Then there was Jill May, an oncology nurse navigator at Allina Health Cancer Institute. Jill couldn't cure Rick. She couldn't change the outcome, but she could provide something equally human: continuity. She knew Rick, she knew Kay, she knew what had happened and what needed to happen next. When things changed, the family didn't have to start over. Rick eventually died on May 2023, at age 67. But his story raises a much bigger question for healthcare leaders. What happens when patients experience one continuous journey, while healthcare systems treat every interaction as a separate transaction? The same problem exists in medical billing. A denial may be discovered by the billing team, but the problem often began somewhere else: scheduling, registration, authorization, documentation, coding, or payer configuration. The person who discovers the problem isn't necessarily the person who created it. That is why I believe healthcare needs to move from reactive revenue cycle management to preventive revenue cycle management. Don't just ask, why was this claim denied? Ask, why did our workflow allow this claim to become deniable? That is where technology can help. Not by replacing people. By identifying patterns earlier, flagging potential errors, reducing repetitive work, and giving physicians and staff their time back. Because if artificial intelligence creates another dashboard, another inbox, and another task list, we should ask, who exactly is being automated? The goal isn't fewer humans, it is more human capacity. That is the philosophy behind what I am building with On Next, helping small and medium-sized practices identify revenue cycle problems earlier, reduce preventable errors, and spend less time cleaning up yesterday's mistakes. Rick's story reminds us why this matters. Technology cannot replace the nurse who says, "I am not going anywhere." But technology can help make sure that nurse has more time to say it. If this resonates with you, what recurring billing or administrative problem is stealing the most time from your practice? Tell me in the comments. If you've solved one, share what worked. And if another physician or clinic owner needs to hear this, repost it and bring them into the conversation. Find the problem. Trace it upstream. Fix the root cause. Because the best healthcare technology doesn't make healthcare less human. It gives humans more time to care.